Hello, everyone. My name is Viviana Haskell, and I work at UCSD Medical Center in Hillcrest, and I work in a cardiac medical step-down unit, 10 East. I'm here to discuss an important issue we face in our medical cardiac step-down unit, which is workplace violence. As nurses, we provide care during some of our patients' most challenging moments, but unfortunately, aggression towards staff has become a daily reality. Violence in any form is unacceptable, which is why my mentor Stephanie and I felt compelled to implement meaningful interventions supported by reliable data. We embarked on this journey towards a project called Shedding Light, Uncovering the Shadow of Workplace Violence. Our project targets the underreporting of workplace violence. We noticed a significant gap between the incidents reported through our official system, iReport, and the calls made to security staff. Security calls made were significantly higher than the report submissions through iReport. This discrepancy highlighted the severity of underreporting. Discussions with nursing staff in the unit revealed barriers such as a lack of awareness about how and when to report incidents, confusion regarding the reporting process, and time constraints. This underreporting reflects a disconnect between leadership and the reality that the nursing staff face on the floor. To address this, we formulated our clinical question. For nurses and nursing assistants working on an inpatient step-down unit, how does the implementation of a multimodal workplace violence education program designed to bring awareness and eliminate barriers to reporting, compared to our current practice, affect the accuracy and efficiency of reported workplace violence incidents? We then began our research and literature review. 9 articles were reviewed for this project, but only 7 were utilized. We drew insights from the aggressive incidents in medical settings, also known as the AIM study, which helped guide our interventions. Stephanie and I had several Zoom meetings with the author of the study, Dr. Yiniko, to discuss workplace violence and the barriers contributing to underreporting. The key finding from our research was that aggressive events occur on a daily basis and negatively impact the mental status of healthcare workers and patient safety. More attention needs to be paid to the nature of these events so leaders can develop a plan to prevent and manage future aggressive events. This is the timeline of the project. I initiated this project in April of 2024 by presenting at the Unit-Based Practice Council of 10 East to gain support. In May, I held one-on-one meetings with staff to assess their knowledge and barriers regarding workplace violence reporting. Education on the AIM study implementation and workplace violence awareness began in June. We also selected champions to educate staff on the AIM study. By July, the AIM study implementation was in full force. We implemented the AIMS log as a data collection tool using clickers to track aggressive incidents in real time. Staff documented incidents in the AIMS log, which took 1 to 2 minutes to complete, while also encouraged to use the formal iReporting system. In August, we analyzed the AIMS log data to develop an educational program focused on raising awareness and addressing barriers. In September, we educated staff on iReport using a multimodal approach. This included video, print, and in-person education. A QR code was also created, which linked to a quick video guide on how to report workplace violence in 5 minutes or less. By October, we introduced an EPIC smart phrase to streamline documentation of workplace violence incidents called .aggression report. Looking ahead to November, we plan to send out a retrospective survey to gauge staff confidence and attitudes on workplace violence reporting. Now to results. This graph represents the number of iReports submitted in 6 months before and after the project interventions began. From September of 2023 to March of 2024, the 6 months prior to the project, a total of 8 I-reports were submitted. That is represented by the purple line. During the project implementation period from April to September of 2024, 33 I-reports were submitted, and that is represented by the blue line. The average number of I-reports submitted over this 12-month period was 3.4 per month. Throughout the project, we successfully increased reporting above the standard mean that is represented by the black line across the graph. The star highlights the exceptionally high value of 10 reports submitted during the month of July. This was during the AIMS phase, where 10 I-reports were submitted in a 2-week period. We were able to get amazing results with a whopping 312.5% increase in I-reports compared to the 6 months prior. During the AIMS phase, we were also able to measure exposure rates. We were able to calculate that nursing staff is exposed to at least one aggressive event for every 40 hours worked. The aggression rate for the unit is projected to be 1,138 aggressive events per year. As I look ahead, I plan to collaborate with workplace violence managers to streamline the reporting process, ensuring continuous monitoring and education. My goal is also to expand this initiative to other units and conduct a retrospective survey to assess staff confidence and attitudes towards workplace violence reporting. Let's address the elephant in the room, but we cannot do it blindly. We need to understand the intricacies of workplace violence. Addressing underreporting requires raising awareness, improving the reporting system, and fostering open communication between leadership and staff. My key takeaways from this project include several impactful outcomes. First, we see an increase in reportings, which I believe will lead to more data-driven safety measures. Leadership accountability has also been heightened as we continue to work to reduce barriers to reporting workplace violence. There has also been a cultural shift towards prioritizing safety, which I hope leads to improved staff well-being. And additionally, we've begun to foster interdisciplinary collaboration. These are the references I use for my project. And I want to thank you for listening to this presentation. And please reach out to either myself or Stephanie Bartholomew if you have any questions. Our emails are provided below. Thank you.